did the analysis. They established levels of concern for the PAHs in shrimp, crabs, oysters, and finfish. The levels of concern were elevated above what normal FDA and EPA levels of concern for seafood. Here's the list. Remember, those were on the previous slides. Next. So the FDA stated, when they established that list and those levels of concern, we have developed specific PAH seafood levels of concern for the unprecedented Deepwater Horizon oil spill event and will not necessarily be applicable after all fisheries are reopened for safe harvest. The FDA levels of concern were based on consumption rates that were way below what people on the Gulf Coast consume. 4 jumbo shrimp per week. How many of you eat 4 jumbo shrimp at a serving? Raise your hand if you only eat 4 or less. How many of you eat more than 4 when you sit down to eat shrimp? Per week, remember. Thus, the levels of concern were based on criteria that wasn't appropriate for the population that they were applying those levels to. Okay. So then, we've been doing blood testing for volatile solvents. The BP crude and the dispersants have volatile solvents in them. Air sampling along the coast, independent air sampling along the coast, is picking up the volatile solvents that have also been detected in the blood of individuals that have been tested. So it's in the crude, it's in the dispersant, it's in the air, and it's in the people who have had their blood tested. The people who have had their blood tested have had medical symptoms, and that is why they requested to have their blood sampled. The blood samples contain benzene, known human cancer-causing agent. Benzene is known to cause leukemia, and I had a call this week from a case of leukemia along the Mississippi Gulf Shore. Ethylbenzene, xylene, hexane, 2-methylpentane and 3-methylpentane, and isooctane. The benzene, the ethylbenzene, the xylene, and the hexane correspond to what we're finding in the air and what's in the dispersant and the crude. And these chemicals are found in the blood. So, what kind of levels? These chemicals are found over the levels you would find in a normal population. The benzene, known human cancer-causing agent, was 36 times higher than the average, which is called the NHANES 95 percentile. The ethylbenzene was 5.7 times. New data that we received Thursday and Friday of this week, the highest ethylbenzene is 10.7 times the normal. Xylene, 5.68 times. So these are not just a little bit over, they're way over what you would find in the normal population. Individuals with the highest